Welcome to the University of Maryland Emergency Medicine Oral Board Primer. We've created a series of videos that depict what it's like to undergo the oral board exam process. The medicine that you'll encounter in the oral boards is actually not that complicated. It's how to apply the knowledge that you have in a simulated case that's the challenge. And our goal is to provide you with 3 different videos that depict different scenarios and how to approach those patients. As you'll notice, the first case is regarding a patient who is actually unstable, and the examiner needs to stabilize the patient, obtain some history from EMS. So that means that they have to actually ask the EMS personnel to stay. There's a lot of teaching points and pearls that are embedded within this first case. The second case involves a stable patient who requires an entire history and physical in order to actually get the diagnosis. And once you have the diagnosis, you have to apply your medical knowledge, which is actually pretty straightforward, and provide disposition for the patient. The triple case is designed to assess the candidate's ability to handle 3 patients at the same time. 3 separate patients will be presented in sequence, and it's up to the candidate to decide which one requires urgent medical attention. In our scenarios, one patient is quite ill and requires emergent medical care. Another one requires emergent pain medicine and ultimately addressing his medical issues, and the third is essentially just a distracting patient. The following slideshow contains some general information regarding the oral board exam. There are a total of 7 patient encounters that are simulated for the oral board exam. 5 of these are single case encounters, which require you to take care of a single patient who is typically pretty sick and requires urgent medical care and hospitalization. There's a total of 15 minutes allotted per patient encounter for the single cases. The other type of patient encounter represents the triple case encounter, where you are charged to care for multiple patients at the same time. There are 3 patients that are presented during each encounter. A total of 30 minutes is allotted per triple case encounter. Some general principles regarding the administration of the oral board exam. The examiner plays the role of everyone you need to speak to in order to care for the patient. If the patient is able to speak, the examiner will play the role of the patient. They will also play the role of the family, emergency medical systems personnel, nurses, consultants, and essentially anyone else you need to speak to. When you speak to the examiner, you need to explain who you're speaking to and who you're addressing directly. For instance, if you want the nurse to perform a task for you, you can say, "Nurse, I want you to place an IV in the patient." You need to verbalize everything. Nothing is seen and nothing is done unless you ask for it. For instance, the patient may be seizing in the case, but if you don't ask what the patient appears to look like, you will never know that the patient is seizing. Be specific about what you want done. Don't ask for just labs. Specify exactly what kind of labs you want sent. The case starts with the examiner asking you if you have any questions. If you have no questions, the examiner will hand you a piece of paper which contains some vital information such as the patient's name, age, sex, how they got to the hospital, and their presenting chief complaint. There's also some background information, the equivalent of a triage sheet in essence. Vital signs are also given to you. On occasion, the vital signs may be incomplete, and so you must make sure that you get a complete set of vital signs. Pulse ox is usually not included, and that's something you can ask for. The first step is to ask the examiner what it is that you see and hear when you walk into the room. This will set up the rest of the encounter. If the patient is unstable, then you can start by placing the patient on IV, O2, and monitor. If they have any kind of neurologic deficits, you can check their blood glucose level. In essence, asking what you see and hear when you walk into the room is the most important step of the exam. As the case progresses, you will obtain a thorough history and physical exam on the patient, either after stabilizing the patient or during the initial encounter. You will obtain the results of the studies that you have ordered through the course of the case. You can obtain consultations as needed, and ultimately you need to provide the appropriate disposition for your patient. The case will end when you have met certain criteria, and you will not get any feedback from the examiner regarding your performance. The evaluation of the exam is based on meeting certain critical actions as determined by the board. Critical actions are relatively few in number and describe actions that are important in properly managing the case. An example of a critical action in the case of a seizing patient may be to check the blood sugar level, or administer certain anticonvulsive. There are 8 performance criteria with a rating scale ranging from very acceptable through very unacceptable. Very unacceptable meaning that you have done something that is actually dangerous for the patient's care. The performance criteria include data acquisition, problem solving, patient management, resource utilization, healthcare provided, interpersonal relations or communication skills, comprehension of pathophysiology, and clinical competence. We hope that you find the included videos and this informational video useful. Best of luck with your oral board examination.